what we call in Ayurveda as Agni. Agni is our digestive fire. So imagine that you have a stovetop, you have the flame on the stovetop. And let's say that you're about to cook food, so you want a nice bright flame to come on. And you're going to cook food 3 times a day, breakfast, lunch, and dinner. So you want that flame to be nice and bright and be able to cook your food so that, you can properly assimilate and digest it. That flame is a good example of our inner digestive fire. That fire can get either diminished, or it can grow into excess, or it can get deranged. And if we don't take care of our inner fire, we don't properly digest our foods. Now, some of the things that lead to this would be improper eating habits, skipping meals, overeating, stress eating, fasting for long periods of time if you don't have the health to do it, excess stress, lack of proper circulation and movement. So a number of things can lead to this. I'm seeing it now almost as an epidemic in our society.
If you suffer from digestive issues such as bloating, gas, constipation, or acid reflux, you know how much of a challenge it can be to figure out why it is happening and how to address it. We are excited to offer a conversation today with Amita Jain, a doctor of Ayurvedic medicine, a certified Hatha Yoga teacher, and certified clinical hypnotherapist who works with her patients on long-term digestive complications, autoimmune disorders, severe skin problems, and much more. My name is Dr. Andrew Wong, co-founder of Capital Integrative Health. This is a podcast dedicated to transforming the consciousness around what it means to be healthy and understanding the root causes of both disease and wellness. It's how Ayurvedic medicine approaches digestive concerns and gut health, and the steps that you can take in your diet and lifestyle to address long-standing digestive issues. We hope you enjoy this. Welcome, Dr. Amita Jain, to the podcast today. Thank you so much for coming on.
Thank you for having me.
Yeah, so Dr. Jain is a doctor of Ayurveda. I know you listened to the intro that we just did, but Dr. Jain, if you could just tell us a little bit about what drew you to become an Ayurvedic practitioner, and we can talk about what Ayurveda is as well. But what do you enjoy most about what you do?
Well, what drew me to Ayurveda is at a young age, I was very much into math and computers. And at the time, not knowing anything about Ayurveda. But I loved it and was drawn to math because it just made so much sense. A plus B equals C, C minus A equals B, and it's always going to be like that, and you can always rely on that. So as I got older, being born in an immigrant family, I was the only Indian in my high school with 2,000 kids. And so, you start to question your identity and where you're from. And so I started to ask questions, to my parents, and they didn't have too much to say, honestly. So I started looking into our scriptures, our ancient scriptures, and that led me to realize that we have this wealth of spiritual knowledge coming out of the East. And I kept reading, and that led me to yoga philosophy, and yoga philosophy led me to the scriptures on Ayurveda and health. And the amazing thing was that it just completely made sense to me. And Ayurveda is all on the principles of balance, and balance equals health. So if you have, a lot or an excess of some element in your body, it creates imbalance. So like plus like equals more of the same. And, being mathematically minded, it just drew me in. When I was 18, I knew I wanted to be an Ayurvedic doctor, but there were no schools at the time. And so I pursued my education in engineering. And as soon as I got out of engineering school, I went to India thinking I'm going to study Ayurveda. And instead, I was led to a yoga ashram, and I spent time there. And then slowly got into more studies of Ayurveda. But that's kind of what got me into it. It's just it was a medical system that made, complete sense.
And like we were talking before we started recording, there seems to be a lot of similarities and overlap between Ayurveda as a whole person, systems-based medicine, kind of a way of kind of blending the art and science essentially. And some of the things we do in our clinic, like functional medicine, looking to the root causes So treating symptoms and root causes, is that kind of what Ayurveda does as well?
Absolutely. So we, in fact, Ayurveda is holistic in the sense that we actually address um, the, the, the mind, the body, the spirit, and the energetic body of a human being, almost as the root cause, considering the body as a blueprint of really what's happening at an energetic level. So in that respect, we use a number of different modalities to help bring the patient back to balance. It's not just treating symptoms or treating what we see on the surface. So absolutely, there's a lot of similarities, it sounds like, between what we both do.
And if there's energetic imbalance, which we can't always see on lab tests, that's the thing. It's hard. Sometimes you can catch it, sometimes you can't. Sort of like needle in a haystack. Even when we do like cortisol testing, it's like, well, sometimes it's there, sometimes it's not. But like when that person walks in the room, if there's energetic imbalance, you're gonna feel that.
Yes, and people come to us usually when they have gone through doctor after doctor, center after center, having taken numerous comprehensive lab tests and being told that there's nothing wrong with them. Yet they are having symptoms, they're not feeling like themselves, they're experiencing tremendous amount of fatigue or body pain. That's the point where they kind of lost all hope and they said, okay, let me try this holistic approach. And they come to us and we're able to tell them that, no, you do have imbalances. And it's like, they have this like relief that, okay, it's not all in my head. I'm not going crazy, because you're right. We don't rely on lab tests as, the whole answer.
Yeah. Yeah, and there was something that I just read about the mind body and how there's a part of the brain that they've just discovered that is kind of connecting the mind body. So how we always talk about mind body connection and holistic medicine. It's almost like the mind and body are really linked inextricably together.
That's right.
Which is what really the science of Ayurveda and yoga is, correct?
Yeah. And oftentimes, especially with very serious chronic illness, we will always link it back to some sort of mental imbalance and caused by childhood trauma or severe amounts of anxiety or stress, negative thought patterns. Almost always you'll see that connection, and that's what we start with first. That's where we look at in terms of treatment first.
Which then affects the biology, which then affects what we might see on the surface
exactly.
when people come see us.
Mm-hmm.
So today, Amita, we want to talk about digestion. We know that the gut is, Hippocrates in the West said, the digestive tract or the gut is sort of the foundation of health. That's kind of where things start, where health starts. That's where health begins, where disease begins. And so we're just kind of curious in the Ayurvedic tradition, how Ayurveda looks at gut health, looks at digestion, and how Ayurvedic medicine approaches digestive issues.
Yeah. Well, now we're reading a lot more of scientific studies proving the connection between our gut health and our physical health. Well, Ayurveda being a practice that ages over 4,000 years, they knew that right from the beginning. In fact, all disease, according to Ayurveda, has its roots in the gut, and that's where disease starts. So we have these various bioenergies, and they will start planting the seeds of disease in our digestive tract. And so if we are wise enough and aware enough to pick up on those imbalances right when they start, Ayurveda calls that the first stage of disease, we can actually prevent the disease from progressing. So in our practice, we work first on gut health, and you'd be surprised at how much healing can be done by simply addressing gut issues.
Yeah.
But we kind of ignore those things, right? Oh, a little bit of, gas or bloating or constipation, or, we just sort of go through our busy lives and not stop to pay attention and think, wait a minute, maybe I need to do something about this, and then in Ayurveda we say, well, now these toxins start to move through the body and we get into the second and third stages of diseases, approaching autoimmune illness, and by that time it gets a lot more difficult to treat.
Mm-hmm. Yeah, so these subtle signs are almost like the body's friendly way of reminding us, hey, there's some imbalance here, can you work on me for a minute before it gets to the deeper stage?
That's right.
Yeah. Also, we know that in functional medicine, I suppose this would also be the same in Ayurveda. If someone has a skin issue or joint issue or a brain issue like a headache or fatigue or something like that, that some of those things can also be tied back to the gut, sort of like the gut
Absolutely.
health affects the system health.
Absolutely.
Okay, great. What digestive conditions do you and your staff tend to work with the most?
We, all the whole spectrum, ulcerative colitis, Crohn's, gastritis, severe forms of constipation. I've seen clients who've been constipated for over 40 years. Nothing has worked for them. Um, Loose stools due to anxiety, urgency to use the bathroom right after eating. Really, the whole gamut, from mild all the way to very severe and chronic, to the point where people are trying to perhaps avoid surgery.
Yeah, so a lot of different conditions, from things that you would consider more common like constipation to things that are more serious like inflammatory bowel
That's right.
disease, Crohn's, and ulcerative colitis. Let's talk about constipation for a second, because I know that, I remember when my grandfather was alive, he said that the first thing is you got to make sure you go to the bathroom
That's right.
every day.
Mm-hmm.
So how do you make sure, or how do you advise, your clients to have daily bowel movements and kind of regularity there?
Yeah, so that's one of the sort of primary discussions we have in our very first visit. Bowel habits, tell me about them. And now a lot of these clients are being told by doctors that it's perfectly normal to go to the bathroom once in 3 days. You're not constipated unless you go 5 to 7 days without a bowel movement. So it's first that education and awareness that no, we have toxins in our body, we have waste, we have to eliminate these wastes through proper and regular bowel habits. So we'll go through that. We'll talk about diet, lifestyle, and the mind and gut connection, and how we can use simple techniques like breathing exercises, meditation, yoga, to help facilitate good habits. I also try to tell my clients that, you've got to educate your family and start with your children, right at a young age, start to get them to be aware of the importance of having healthy bowel habits, and to make time for that. So some of the patients that I've seen that have been struggling with constipation for many years started in childhood, holding back the urge to go to defecate, not having education from their families, thinking that going to the bathroom was ew or yucky. And that never gets resolved, and it leads into these sort of permanent habits of the wiring and programming of our brains. And then, like I said, these diseases get a bit more stubborn, and then they lead to what we call in Ayurveda ama.
Okay, like the toxins and all of
That's
that.
right.
Okay. Also, I know that a lot of people do have what is conventionally called irritable bowel syndrome, where they might have constipation, but they also might have more looser stools, diarrhea. How do you address that? And I kind of specifically wanted to ask about parasites or H. pylori, or any sort of bacteria, parasites, fungi. How do you kind of look at that? Do you use herbal antimicrobials, or do you kind of look at it more from a terrain perspective?
So to answer your first question, first we explain, I kind of give an example to the client about what we call in Ayurveda as Agni. Agni is our digestive fire. So imagine that you have a stovetop, you have the flame on the stovetop. And let's say that you're about to cook food, so you want a nice bright flame to come on. And you're going to cook food 3 times a day, breakfast, lunch, and dinner. So you want that flame to be nice and bright and be able to cook your food so that, you can properly assimilate and digest it. That flame is a good example of our inner digestive fire. That fire can get either diminished, or it can grow into excess, or it can get deranged. And if we don't take care of our inner fire, we don't properly digest our foods. Now, some of the things that lead to this would be improper eating habits, skipping meals, overeating, stress eating, fasting for long periods of time if you don't have the health to do it, excess stress, lack of proper circulation and movement. So a number of things can lead to this. I'm seeing it now almost as an epidemic in our society. So what happens now, a lot of people are coming in with this deranged Agni, and it's about explaining them how to respect your body's natural rhythms and eat at proper times. There is a window of eating when our digestive fire comes on the strongest. And as you probably know, when the sun is the brightest, our own Agni is the strongest. And so that's why we want to have lunch between the hours of noon and 1:30 to 2 p.m. You don't want to have lunch at 3 o'clock in the afternoon. You definitely don't want to push dinner into the night, because when the sun goes down, our Agni goes down.
Okay.
And now, of course, we're seeing, studies showing that when you eat late at night, you're going to have improper sleep. That food's going to turn to fat. You're going to wake up feeling groggy. So that's the one thing we're trying to, teach all of our clients is you've got to take care of this digestive fire. Now, when that fire gets deranged, and I mentioned this concept of ama, toxins. These toxins start in our gut and then start to move through our body. And these toxins can lead to candida. They can lodge in the joints and lead to arthritic pain, osteoarthritis, and they can lodge into the brain and cause neurocognitive dysfunction like brain fog and memory loss, and a host of other issues. So even in a case of bacterial infection, as you mentioned, or candida, we're looking at getting back to strengthening Agni, and that's where we use effective Ayurvedic ancient formulas and remedies. So these herbs are excellent at helping to proliferate that healthy gut bacteria and to get rid of candida, building up our gut army, and helping to eradicate bacterial infections in the gut. But that alone, is not going to do the job. So it's part of a lifestyle training that you're going to take these herbs, but along with that, we're going on a strict diet for the next 3 to 4 months.
Right.
We're going on a strict eating routine.
It can't just be the herbs.
It can't just be the herbs.
Yeah.
That's right. So it's a whole plan. It's a whole a system of education, and sometimes it's a tough conversation because the clients are getting so much other information on the internet and on Google, and there's keto diet and there's intermittent fasting, and then there's all this, and so but when they understand what's actually happening inside their gut, it's like a light bulb. Oh, I get it. Yes, I can relate to this. And that's why Ayurveda makes so much sense.
Well, I think I'd rather go to Dr. Jain than Dr. Google, but anyway, yes. So I have some semi-funny questions and some more serious questions. So one of the semi-funny questions I have is I love this Indian buffet out in Germantown, but then we're talking about Agni and how it's better to eat at a certain time. Don't eat too much. What do you think about as a doctor of Ayurveda? What do you think about buffets and sort of these type of all you can eat? I'm gonna stuff as many pakoras on my plate as possible. All you can eat mango lassi, right? What are your thoughts about these type of things?
So let's say, for example, you're a person with strong Agni. Okay, meaning you're having good regular bowel habits, you're able to digest your food, you're without ama or toxins. Generally, people like that, hey, every once in a while, you want to go to the buffet, go to town and stuff yourself, you'll heal from it.
Every once in a while, that's
once in a while. That's right.
Okay.
You want to treat yourself
right.
Once a month or so. You know what? You're gonna recover from it. Where it becomes more of an issue are the people who have weak Agnis. Weaker digestion. Yeah. Now they don't recover as quickly, and that overeating from that buffet, they're just now accumulating toxins in their body, and they're going to feel the effects the next day. Mm-hmm. They're groggy, they're slow, they're tired, they have brain fog, they're not clear, alert. All of those things, tend to manifest pretty quickly. So it just comes back to what your personal digestive condition is and what we call your dosha prakriti, or your sort of natural birth constitution, and how you can handle these different foods.
So someone with a quote unquote heavier dosha, like a kapha dosha, might be less likely to handle that
absolutely
kind of buffet.
That's absolutely
okay. And then wondering about I know here we say a lot about like chewing your food and chewing slowly. So what does Ayurveda say about the amount of number of chews per bite, if that's even something that you would recommend there?
Yeah, Ayurveda says that digestion starts in our mouth. It all starts with chewing. The number of teeth equals the number of bites you take.
Okay.
I know that's hard to sit and count 32 times.
It is. It is a lot, but I have noticed, and it is hard, honestly, because I'm like, I love this food. I just want to like eat as much as I
Yes.
can. But it does make a difference. I mean, I can feel it in my stomach. It's like that.
Absolutely.
So,
And the idea is that you want the food to become liquid in the mouth.
okay.
And that's why weak
Yeah.
Agni, what we do is we tell people, hey, start having soups,
Yeah. Yeah.
right? Because that's already liquid.
It's already
It's
kind of
easier.
pre-digested.
Yes,
Okay.
that's
Okay.
right.
Got it. I'm curious about the herbs. I know this is a question that kind of comes up sometimes in our practice with herbs, or even like we might recommend different oils and things like that. A lot of times we're asking if companies test for heavy metals or contaminants. What are your thoughts on that, on the herbs that are sourced from, say, India or China or
That's right.
wherever? Yeah.
It is, it's a good question because it is a serious concern. And we really do have to be cautious and careful from where our herbs are being sourced. And of course, a lot of these classical formulas of Ayurveda come out of India. But there's a huge concern of heavy metals and pollutants in wild crafted herbs, which is sort of the thing now, wild harvested. That's not necessarily a good thing. Organic, it's now coming up. And there's more and more third-party testing being done. But generally, you want to go with reliable, reputable companies that do a lot of testing on all the batches of drugs that go out. So it is something we need to be careful about. In the same way that we choose our foods, we choose local, we choose organic. Same with the herbs.
Choose good companies, and then the other thing is really for some sort of gut plan. I think a lot of people ask, and this might be individualized, but so they might ask you, Amita, like, how long will it take me if I'm on a certain nutrition plan, and herbal plan, and lifestyle plan to heal my gut or to feel better, and kind of maybe it's individualized for each person.
Yeah, so it can take anywhere from generally 3 to 6 months.
Okay.
Stubborn case of candida can take longer. Crohn's, severe cases can take 9 to 12 months with an Ayurvedic protocol.
Yeah, that makes sense. I mean, healing takes time, and the way I was taught too is that the longer something has been going on, it takes longer to heal.
It takes longer to heal.
Patience is virtue in this situation.
That's right. But at least we're getting to the root cause, and you're getting to real healing as opposed to just suppressing symptoms.
Right, exactly. Well, I see you have a beautiful purple piece of clothing on, and this reminds me of something that happened to me a long time ago when I was at a doctor, and they gave me something called the purple pill because I thought I had reflux, So there's a pharmaceutical that they advertise as the purple pill, and so I took it one time, and then I was like, you know what, this doesn't really feel right to me. I think I'm going to try nutrition. I'm going to try some things on my lifestyle to change that when I didn't need that. So we want to talk about acid reflux. That's another area on the gut that, the number one, number two sellers, I think a lot of times for drugs are these like proton pump inhibitors, also called acid blockers. What do acid blockers do to the Agni, to the digestive fire? Are there other more natural ways to treat acid reflux?
Yeah, it's a very common condition that we see in our clinic, and PPIs really do destroy our healthy gut bacteria, and they also weaken greatly our Agni. So even though the patient thinks they're feeling better, actually, when they come off, the PPI symptoms can come back much, much worse than before. So what we're trying to do is educate the patient in the difference between what the PPI is trying to do and what our herbs are trying to do. So if there's inflammation for gastritis, what we want to do is reduce that inflammation so that they're not having the acid reflux symptoms. And so we do that the combination of wonderful time-tested, proven herbs from Ayurveda that are very mild, that work over time, and a diet. So we will put them on a strict diet. You got to cut out sour, you got to cut out citrus, oily, and very spicy foods. Which is often the toughest, especially from the Indian community. It's like part of every meal.
Love the foods, yeah.
But the healing is quite dramatic when they take that approach.
What about dairy? Where does dairy fit into acid reflux?
So dairy, there's certain types of dairy. There are categories. For example, cheese will aggravate acid reflux. In Ayurveda, if you have a good quality of pure milk, which difficult to get here, but if you can get your hands on some non-homogenized, local, healthy milk, then it can actually help pacify some of the reflux symptoms.
There is a good brand that I saw at Mom's called A2. There's like the A2 version.
That's right, A2. There's also
that's pretty
milk
good.
from, I don't know if you've heard of the Trickling Springs
Yeah.
local creamery.
Yeah. Okay. Non-homogenized.
Non-homogenized,
Right? Yeah.
yes.
So it's hard to pour because it's like super creamy or
Yes,
something like that.
yes,
Yeah.
yeah.
What about ghee? Is that considered okay there for, say, someone with reflux or bloating?
Yes.
Okay.
Ghee, yes. Other oils we try to reduce, but
Okay.
ghee is very soothing to the digestive tract.
Yes. And then this is not a medical treatment podcast, so we just want to say that disclaimer. I'm just curious how you would treat someone that has reflux symptoms, but also may have, and they're on a PPI, let's say, a proton pump inhibitor, but they also have endoscopic evidence of ulcers or Barrett's esophagus. Like, what's the Ayurvedic thought about that?
So we get into this situation where if we prescribe our herbs and they're on these PPIs, the herbs actually don't take effect because they're working in different ways. So what we do is we start them on a diet, breathing exercises, because breathing is very healing for the gut and for ulcers, and some yoga. And then we also teach them sort of affirmations, positive affirmations. And so they're starting the healing process. And at the same time, they work with their physicians to slowly and gradually taper off the PPI. And then when they're finally off, because they're feeling somewhat better already, then we start introducing the herbs. And that's where the real change comes in. So the herbs can do their work in healing some of these ulcers, and slowly and gradually the patient starts to feel a lot better. And we do regular follow-ups with them and feedback with them so that we know we're on the right track. But depending on the severity, time ranges.
And this is a little bit of a sidebar, but we like rabbit holes on this podcast too. When someone is kind of working with you and they have, say, like a primary care practitioner, someone Western trained, I'm Western trained, but also integratively trained. How do you work with those kind of doctors? In terms of the patient may have their primary practitioners or other medical specialists.
Well, I see all caretakers and practitioners. We're all a team together, and
Right.
we all have the end goal of our patient getting better.
Right.
So sometimes I will give some information to my client. They'll go back and discuss it with their physician. And I always try to encourage them to do that. Because sometimes physicians they may not have the same knowledge we have. I don't have the same knowledge they do. And so if I am giving them some herbs to take or even diet lifestyle changes, I'll say, let's have a conversation with your physician. And oftentimes when we approach it that way, the physician's very open to it. And, they'll just say, okay, if you're on these kind of prescriptions or medications, we want to avoid this. But they are generally very open and receptive. So I think that more and more physicians are starting to feel themselves that we need a more elaborate, comprehensive team to the whole holistic and healing approach.
Absolutely. This is a podcast on gut health and Ayurveda, but yesterday I just saw a patient who said their thyroid was completely healed with Ayurveda. It's like amazing. So there's so much that I think we can learn, and we can learn from working together in the service of helping that patient get better. We also know that a lot of people have gas and bloating, which is a fourth, concern in terms of digestion. What would you say to a patient that says, hey, Dr. Amita, I have some bloating and gas after each meal? Where do you go from there? Is that an Agni issue or is that something else?
Yeah, also very, very common now. So after we've educated them on healthy eating habits, now we're also looking at hormones.
Okay.
And hormone panels, especially women as they go through their natural transition in their 40s and early 50s. Sometimes that can cause onset of bloating and gas. Sometimes a major life change, changing a job or a hectic lifestyle. You kind of, like, as you mentioned, you forget to chew your food and you're sort of hurrying through eating. But also, even in men also go through hormonal changes, and that can affect it. Hypothyroidism can lead to gas and bloating. So now we're looking at, the good thing is that, hey, they've come in at the early stages of disease, the first few symptoms, and that's exactly where we want to tackle things.
Yeah. And I suppose you would also recommend, curious, I see a lot of people now eating their lunches, or, they're kind of hurrying up and things like that. They have the cell phone there. They're scrolling through the news.
Oh, yes.
It may not be.
That's how my husband eats every night.
All right. We're calling out your husband here. What are your thoughts on things like, distractions or watching TV while you're eating and those type of things?
Yeah. Well, if you sit down with a meal and you actually look at your food before you eat, you look at the food and you smell your food, you're going to start producing the enzymes that you need to properly digest that food. And if you're taking bites and you're tasting and you're chewing, not only are you going to digest and assimilate better, but you are going to be acutely aware of what foods suit you and what don't. You're going to be able to listen to your body's natural response to various foods, and you will become your own doctor, because you will say, oh my God, wait a minute. I thought that a salad would be good for me, but when I eat these raw foods, I feel bloated and gassy and I feel lethargic. And that's absolutely right. Not everyone has the Agni strength to digest a salad. And sometimes the salad can be the absolute worst thing you can eat. But if you have a warm cooked rice bowl with lentils and vegetables that are fresh and cooked to soft, and you eat that and you say, I feel nourished, I feel good, I don't have bloating, I feel light, then guess what? You don't need to turn to Google or to anyone else to figure out what foods are right for you. You have that own intelligence, but you have to be alert and aware to be able to listen to what your body's telling you.
So get off the cell phone, get off the TV, listen to your body, do some breathing,
Yes.
chewing, looking at the food,
Yes.
stimulating the enzymes.
And it's difficult. It's hard. It's
sure.
practice.
Especially nowadays, right? Yeah.
Yes.
Well, I know traditional Chinese medicine, which I have some background in, they're really big into ginger and kind of stimulating and hot foods, and also eating seasonally.
Mm-hmm.
How is Ayurveda in terms of temperature of foods and maybe even food combinations?
Yeah, very
Yeah.
big, very
Yeah.
very important part of Ayurveda. And so we eat according to the times of the day and the seasons, and according to our Vikriti, or our disease state or condition. So even the herbs, like you mentioned, ginger's excellent to heal a number of digestive issues for certain types of people. But ginger is also very heating, very dry, so it might not be the best herb in the middle of summer.
Okay.
And similarly with seasons, as you said, we want to eat what's local, what's growing. We don't want to have pineapple or watermelon in winter. Our body's just not going to be able to produce the same enzymes to digest that food, even though they're, quote, healthy foods. So the herbs according to time, day, season, and same with our foods.
Got it. I have to talk about a superstar that we think about as a superstar, turmeric. Turmeric is something that we know in functional medicine can decrease some of the markers for chronic inflammation, like NF-kappa beta, can basically help a lot of people. But where are you with turmeric, and, is that for everyone, or where do you kind of see turmeric in general?
Well, excellent. Yeah, I really want to talk on this topic. There's a lot of misinformation out there as well. Wonderful. One thing is that turmeric absolutely is the ultimate superfood. Especially for anti-inflammatory properties. It is excellent. However, because it is a superfood, it is so concentrated, so packed with all these nutrients, we have to take it in small amounts. More is not better. What happens is I see people coming into my clinic and they're like, I was diagnosed with this. I started taking turmeric. I've been taking, 1 teaspoon every 3 hours, every 4 hours, because so-and-so told me to do this. And they're worse off because, like any other herb, it has its qualities, and too much, you're going to go into excess. So we really need to take it in small doses. There are different ways to take turmeric. You can take it as a paste. You can take it in food. You can take it with water. You can take it topically. You can have it with ghee, you can have it with honey. So these are called anupanas, like what mode of that carrier, are we using turmeric for? So it's got to be taken in the right dose and in the right form. The other thing I want to mention about turmeric is that a lot of this herb that we're getting here off the shelves lacks in curcumin. So curcumin, as you know, is the cancer fighting power in turmeric, and it's what gives turmeric its color. But because the nutraceutical industry has capitalized on curcumin, a lot of it is extracted out of the powder, and so they're selling the powder without curcumin in the stores, adding, coloring to it to give it its orange color. So we have to be cautious about that. Also, I want to talk on curcumin extract supplements. Not the same thing. Yes, they're advertised as being more potent. You will see, effects more quickly, and that is true to some degree. However, whenever you extract any property out of its whole, you're going to have side effects from it. So I see people too, for joint pains, they've been taking curcumin for like 8 months, and now they have other issues. So my advice is, take turmeric as a whole herb. If you are taking it for sort of preventative, therapies, put it in your food, as we do in classical Ayurveda in India. We've been using turmeric for thousands of years. You just add a 1/4 teaspoon into your food while cooking, and you're going to get a lot just from that.
And it's better absorbed with food, I believe, right?
That is right.
Right, turmeric?
That is right. And if you do want to take it for therapeutic purposes, then see your Ayurvedic practitioner.
Great, got it. So this is all really great, specific information and general information too. Thank you so much, Dr. Amita. Do you have any recommendations for practices that people listening here can incorporate at home for general digestive health? Let's say they have nothing specific wrong right now. They just want to kind of optimize their agni, their digestion. What are some of the kind of top tips you're thinking in terms of how to optimize their digestive health?
Okay, first thing upon waking, 2 cups of warm to hot water. First thing. Coffee should not be the first thing that you put inside your body.
Darn it. Just kidding.
You can have it. It comes later.
All right.
You're drinking coffee first thing, you're hurting agni.
Okay.
2 cups of warm to hot water. The second thing is breakfast should be light and easy to digest. So if it's summer and you have good, juicy, sweet fruits, local, that's wonderful. Through the colder months, have some porridge. I see a lot of people having very complicated breakfasts. Either they're having eggs and orange juice and toast with that. And you mentioned food combination. Ayurveda stresses a lot on the combining of foods. So the simpler you can make your meals, actually the more benefit, the more nutrients you're going to extract from that. And you're going to put less burden on your digestive system. So I would say soupy type porridges in winter are great. Sweet fruits in summer are great. Fresh juices are wonderful in breakfast. And then your lunch should be your heaviest meal of the day. A nice balanced meal of whole grains and vegetables and some protein would be wonderful. And not skipping lunch. Lunch is when your agni is the strongest. So if you start skipping or delaying lunch, you're going to derange your agni. Dinner, again, keep it light and keep it early. If you can eat before 6 o'clock, you're going to do your body good. You're going to sleep well. You're going to feel much more energized the next day. And I like to think of dinner as soups and stews, curries with rice. Look towards some of the more Asian dishes. And of course, in the warmer months, in summers when agni is naturally stronger, that's when you can have your salads. You can have a salad for lunch or breakfast.
Okay.
But don't try to eliminate the dressings. Have your olive oils, coconut oils, lemon juice as your dressings. The other thing I want to mention is not to have liquids with your meals. If you just make that one simple change, you're going to have you're going to see a great improvement in your digestion, and especially if you're having bloating or gas.
Let's drill down on why that is. That's a really, really great point.
So liquids, they put out our fire, right? You think about your flame on your stovetop, you're pouring water over it.
Yeah.
And now you put in food and that flame is diminished.
Whether
right?
it's cold or hot, like even if it's like a hot tea, that would still diminish or dilute it.
That's right.
Okay.
That's right.
Okay.
So avoid with your food between meals. Room temperature or warm fluids are the best. Have your herbal teas.
How long to wait before or after meals?
30 minutes before a meal.
Okay.
And an hour after.
Okay. Good to know. I remember that my dad owned a restaurant, and all the cooks, in the kitchen, they were like, yeah, they never drank any liquid with their meals. And I was like, oh, I guess that's probably why.
Yeah. Like if you go to India, you don't
Yeah.
see people walking around with water bottles all the time. And it's like, 110 degrees in summer.
Like this water
Like this
bottle, like
huge water bottle.
carry down
That's
everywhere.
right.
Yeah.
That's
yeah.
right. And that's because we get water out of our meals. So
Yeah.
almost all Indian
Yeah,
meals
yeah.
are going to have some type of dal or curry, or in South India, they have sambar, which is like a soup with spices and vegetables.
Oh yeah. I've had that. Well, I mean, those type of meals are more plant forward or plant centric. They probably have more hydration in them.
Absolutely.
Anyway, yeah.
That's right.
Yeah. Great. So all these things are really, really helpful. I think that, the water bottle has its place, but maybe between meals, it sounds like.
That's right.
Yeah.
Between meals.
Okay.
Between meals. And include healthy oils in your diet. I just cannot stress the importance of that because our colon gets dry often from, various stress and activities. But healthy oils, ghee is wonderful. Coconut oil, unrefined virgin is wonderful. Olive oil, avocado oil. Include those in your diet.
That's so great. Now, part of our mission here at Sage is making integrative healthcare more accessible and focusing on the small steps we can do to improve our health. I know that you created your company Vedic Health as a nonprofit to serve people in a deeper way, make this type of natural medicine more accessible, which is really great. So kudos to you for that. Mm-hmm. Love to hear from you. What is one thing, Dr. Amita, that under $20, I had a guest come on one time and said, oh, can it be under $100 because there's a lot of inflation now? But what is one thing under $20 that you feel has transformed your health and you feel like maybe could benefit our listeners?
Boy, that's tough because I can think of so many that are actually free.
Okay. That's under 20. That's under 20.
Okay, I'm gonna give you 3 things.
Awesome. Great.
Okay.
Got
Number 1.
2 bonuses.
Can't stress the importance of deep breathing.
Okay.
It's free.
Yes.
It's easy. No one needs to know you're doing it, and the effects are just remarkable. Learn how to do it correctly.
Okay.
Take a pranayama class.
Okay.
I do teach a pranayama class for many years, and
pranayama means what? Just for listeners, what does that mean?
It's the science of breathing.
Okay, science of breathing. So
okay.
Pranayama, deep breathing, is free. That's so great. It's going to give you energy.
That's right.
Yeah.
The second thing I want to say is Ayurveda's classical super herb for digestion.
Okay.
Is called Triphala.
Triphala, yes.
You've heard of Triphala. It's being more and more used now.
More popular, yeah.
Yeah, and it's a combination of 3 Indian fruits in their whole form, just dried. And Triphala is excellent for digestion. It's also known as a rasayana, which is kind of like something we can take for our general health, for maintenance, for prevention. But it's so good in helping keep our healthy bacteria, our gut microflora, our digestive tract working, keeping out invaders and pathogens. But it's also good for a number of other things, for our eye health and for our deep tissues. So Triphala can be taken very safely by almost everyone. It's such a mild herb. It works over time. So do some research on Triphala. And, you could start with a 1/4 teaspoon at night in a cup of warm water.
Okay.
Just drink it before you go to bed.
Okay.
And especially in cases of constipation, gassiness, bloating, you will see a big improvement with that. And the third thing I want to talk about is some simple yoga asanas. So people think that, to get the most out of yoga, you have to go to a studio, you have to do a whole hour's class.
And you have to buy the sweatpants.
You have to,
right?
you have to fit into these tight yoga pants, or you have to go to Lululemon and look cool. No. There's actually 3 asanas that you can do easily at home on a daily basis that actually help to stimulate a lot of the sort of peristaltic movement and nourish and rejuvenate our internal digestive organs. So a simple one is child's pose.
I love that pose.
Believe it or not, it is incredibly, it's like giving your whole gut a massage, a deep tissue
Love
massage.
that.
So get into child's pose, hold it for a minute. And then the other one is cobra pose.
Okay. Oh, that's the one where you go up with the, yeah. So you're on a mat. You have to be on the floor for that one, correct? Yeah. Okay.
Yeah, that's
Yeah,
right.
yeah.
Be lying down. And then when you're lying in bed, if you can't get into a child's pose, and you just pull your knees up to your chest.
Okay.
And it's also known in yoga as the wind relieving pose.
Okay.
So it's very effective at reducing, gassiness, and just helps you kind of sleep better, calms down nervous activity. So just pulling your knees into your chest like a ball. And the key is to hold these poses and to breathe slowly and deeply while you're doing them. So holding it for a minute.
A minute. Okay. Okay. Yeah, I notice sometimes doing child pose, even like at my desk, if I don't have a mat, just putting the forehead on there. Would that also kind of count as a semi-modified pose?
Yes, absolutely. Yeah.
Well, this is great. I think that's a really key point about the asanas is sounds like holding it there to get the benefit from them more than just, how like in flow, sometimes it's just like, oh, do that. And then like 3 seconds later, you got to go to another pose.
That's right.
Kind of like Gumby or something.
That's right.
Yeah, not that, I enjoy flow, but then on the other hand,
Yeah.
I don't know how relaxing it is for the digestion.
That's right. And the therapeutic benefits, as you said, come from holding these poses. So when you pull your knees into your chest, you're essentially squeezing out blood, stagnant blood. You're squeezing out, and you're forcing energy to move out of these digestive organs. And then when you come out of it and you're resting now, that's also key in between these asanas, that you're giving your time rest. All this new sort of healthy, fresh, oxygenated blood comes into the organs, as well as prana from your breath. And it's like, it's rejuvenating.
Yeah. This is so great. Thank you so much, Dr. Amita, for coming on today. You're really a wealth of knowledge on Ayurveda, and I know listeners are wondering how can they learn more about you and work with you and your team.
Yeah, sure. VedicHealth.org.
So you're local in DMV, right?
Yep. We're located in Rockville, Maryland.
Rockville, okay.
We have a center, Ayurvedic center. We do all kinds of Ayurvedic therapies there, ancient therapies, health consultations. We do energy healing. We do counseling. And we also offer Hatha Yoga, which is a very traditional form of yoga. It's focused on healing and highly therapeutic. We also offer these deep breathing pranayama classes, meditation classes. So we're kind of like, Eastern health all under one umbrella in
That's
one
great.
location.
And Vedic Health is VEDIC health.org? Org. Okay,
That's right.
Got it. Great. VedicHealth.org. Dr. Amita Jain, thank you so much for coming on today, and pleasure.
Thank you so much, Dr. Wong. This was wonderful. I seldom get a chance to talk about these things, so it was great to be here, chat with you.
Thank you so much. Thank you so much for joining us today for this episode of the Capital Integrative Health Podcast. A quick reminder that the information we share in this podcast is meant for educational and informational purposes only. It's not a substitute for professional medical advice, diagnosis, or treatment. We highly recommend that you speak to a qualified healthcare provider before making any medical or healthcare decisions. If you enjoyed this episode, please take a few moments to subscribe and leave us a review. Your reviews help us reach more people and continue to offer innovative insights and information to better optimize your health and wellness.